Our next speaker is Mr.Nrip Nihalani, CEO of Plus 91 Technologies, which helps doctors publish their own websites.
Good morning, everyone. It's fantastic to see a full house out here, almost a full house. Well, technology has been pervasive in all forms of life today. And we see that almost every industry, whether it's legal, whether it's finance, is benefiting from technology. In the next 10 minutes, I'll talk about how technology can be used to influence information therapy. Well, first we'll look at a typical treatment process. And for all the skeptics out here, I will not be talking about preventive health. We're just talking about treatment as is. So the basic part of treatment is diagnosis, information gathering, and treatment. The patient goes through the process of finding a good doctor. It could be a specialist, it could be a general physician. He gets treated, he solicits a second opinion, and then finally he accepts the diagnosis. There's a strong possibility that he does not accept the diagnosis, and then he goes and finds himself, going into this loop. Besides that, a part of the treatment process is participation in research, because this is what feeds treatment in the future. Treatment of other friends, family, and other people whom the patient probably doesn't even know. And then the patient becomes a champion or an advocate for either the doctor, the treatment, or the hospital, provider, insurer. Now, over the years, we've seen that the second and the third part, that's the participation in research and being an advocate, is something which is not coming into the limelight too much. It's something which is not spoken about too much. It does happen, but it never gets spread out. You see, this was considered a long-drawn process by most people because it was not very easy to communicate. I mean, if you had a particular case and somebody else in the United States has the same case, if you wanted to reach out to this patient, you had to write letters, you had to make expensive phone calls. Some people would do it, some people wouldn't. But let's look at today's times. You've got the internet, which is available everywhere. You've got facilities like the email, you've got mobile phones, and you've got this whole social media bandwagon with applications like Twitter and Facebook. And what this has done is, this has had the effect of providing a case where real-time communication between patients, doctors, just about anybody is possible. You have 24/7 access to information. You can actually solicit feedback from just about anybody, and you can easily solicit opinions, multiple opinions, second, third, fourth, whatever you want. This has led to the creation of certain demands in the minds of people. Okay. While Rajesh was asking some questions in the beginning, I heard the audience talk about the need for empathy by doctors. Level of understanding should be improved. There should be a lot of focus on actual care, knowledge about patient rights, and general awareness. Besides these, we've seen that demands such as convenient access to healthcare, improvement in the quality of care, improvement in the facilities that are provided to patients, cheaper alternatives, and most importantly, convenient access to health information, becoming something which people are demanding. Patients are demanding this, but also doctors are demanding this. What can technology do? Well, the first thing that technology can do is to take a step back. Look at the overall scenario. If you try to focus on one particular player in this environment, there is absolutely no way that you're going to succeed. For example, you can come up with a great application, or you can come up with a great website or an EMR product, and you're supposedly focusing only on one player. Suppose you're focusing only on a doctor and the staff refuses to use it. You're not going to get the success. Same way, if you're going to come out with a medical website and you're going to focus only on patients, and the doctors who are actually the owners of these websites are not thrilled about what it does for them, there is no chance of this doctor wanting to promote this website. And in the long run, the patients are not going to benefit. So one thing that IT should do is to look at the ideas, marry them with utility, and then make sure that they're looking at all the actors in this entire healthcare ecosystem. It could be a healthcare provider, it could be a doctor, it could be patients, and within these avenues themselves, look at the bifurcations. Suppose you're providing a solution which is for a hospital. Think about, do the patients really benefit from this? Will the staff actually want to use this? We're not talking about a detailed analysis, but a little bit of thought is definitely required. So one thing that IT should do is have a clear idea about who is directly going to be impacted, who is indirectly going to be impacted, and have some empathy for each and every player in that system. If we look at a roadmap for technology to impact information therapy, we're not going to talk about the whole healthcare ecosystem. We're just talking about information therapy. We see that it's important that the basics is done right. In each of these avenues that's listed out here, so we're looking at, say, something like medical information sources. We can have a talk only on medical information sources right now, which is going to last 30 minutes. But let's just look at the fact that if technology does not work and provide good medical information sources, there is absolutely no chance of it going to be able to create its own healthcare IT ecosystem. So IT should, for a start, work on the basics. There should be enough impetus on medical information sources. There should be enough impetus on providing online health communities. Now, communities anywhere are fantastic. You have a community of people which is getting together to discuss a disease, or getting together to talk about the type of doctors available in a certain suburb. That's all fantastic. These can be taken online and made more effective. Digital identities for doctors. It's a very fancy word for websites for doctors. I mean, forgive me, I sell them, so I know a little bit more. And I use these fancy terms. And healthcare yellow pages. So providing digital identities for doctors and providing yellow pages for these identities is something which is mandatory because it provides more choices for patients to hunt for information. It also provides information to doctors about their competition everywhere else. Better patient-doctor communication technologies and health information exchanges. Now, what are these? We're just going to look at some examples. Medical information sources, there are different types. You've got HealthWise providing fantastic information for patients. You've got stuff like WebMD, which is very simple information, I think sourced from HealthWise. And you've got something like Health Epic, which is working completely on alternative therapies. They're all different types of medical information, but they're sources in their own right. Digital identities for doctors, very simple, something like pipcdocs.com. You can check it out on your iPads or phones if you want. Healthcare yellow pages, you've got directories like Infinite Health. There's a Delhi-based company called justhealth.com. Really fantastic stuff. 1 second, please. I've got to take this call. Hello?
Hello. This is a simple
Can you hear this?
that you have to take a 100 mg tablet of Valium in the next 30 minutes. Please don't take the tablet on an empty stomach. Have a great day. Thank you.
This is an example of a patient-doctor communication technology. Something called smart patient alerts. We're just going to look at that in detail. I think I'm running out of time, so I'm just going to run through this. I'm going to go into this detailed example primarily because at least one of the topics we spoke about, I want to give an example of what all can it do and what all it can't. Alerting systems today are trying to inform patients about when to take their pill, when to take their medicines, when is an appointment supposed to be catered to. But most of the alerting systems today are not focusing on the overall ecosystem. The delivery mechanism could only be SMS. Why should it be like that? We should be looking at delivery mechanisms which are focusing on where people exactly are. For example, a lot of people out here are on Facebook. A lot of people are on Twitter. People are checking emails. There are doctors who don't have Twitter. There are doctors who don't actually use their phones as much as we would like. So the alerting system should be alerting on all categories of healthcare. They should be talking about patient safety. They should be working on wide area health alerts. For example, there's an epidemic, inform everybody about it. Appointment reminders, everybody does it today. Appointment management, setting appointments. Prescription reminders, again, there are companies working on this today. Lifestyle reminders, something which is more related to your diet plans. You've got diet plans, let people know about the fact that you should be eating this in the morning, you should be eating this in the afternoon, you should be eating this in the night. Exercise at this particular hour. So it's important that the systems are actually catering to all this. And at the same time, the system should be providing delivery mechanisms which are catered around where people exactly are today. So if people are on email, people are using the phone to talk to people, make sure that the delivery of these alerts is happening across the board, not just on one of them. I think I'm running out of time, and the beep goes. For any questions, I'm available on email, Twitter, and on the phone. Thanks.